Are inversion tables good for lower back pain? In this video, I'll explain the benefits, what to be aware of, and how to use an inversion table for lower back pain. So let's get started. First of all, how does inversion therapy actually work? The concept is pretty simple. Gravity presses down on your spine all day long, and that compresses the joints and the discs in your spine. When you invert, you reverse the effect of gravity, so it's actually decompressing your spine. The concept has been around since the time of Hippocrates, when he hung people upside down by their ankles. And just the fact that it's withstood the test of time, much like acupuncture, indicates that it's probably helpful for at least some people. But there are some research studies to back that up. One looked at a group of 47 women with chronic lower back pain lasting on an average 23 weeks. That's just a little less than 6 months. They grouped them into groups where one group laid flat on an inversion table, one went 30-degree decline, and one went to a 60-degree decline. The protocol they used for each of them was 3 minutes times 3 sets, 4 days a week for 8 weeks. And at the end of that 8 weeks, what they found was greater improvements in pain and spinal flexibility in the group that inverted to 60 degrees versus the groups that were just flat or 30 degrees inverted. So there does seem to be some effect of the amount of inversion that makes it a little bit more effective. Now, another study followed 24 people with back pain that were on the waiting list for surgery. And in the meantime, they randomized them to a physiotherapy group or physiotherapy plus inversion. By chance, 11 ended up in the regular physical therapy group and 13 in the physiotherapy plus inversion. And what they found is that 10 out of the 13 people in the inversion plus physiotherapy group canceled their surgeries, whereas only 2 out of the 11 in the regular physiotherapy group canceled their surgeries. Now, an interesting thing is that they also measured measures of pain and disability and the MRIs, and there wasn't a significant difference between groups. So what that says to me is that the inversion gave people a coping mechanism that they could deal with their problem rather than thinking that back surgery was their only option. So next you may wonder, are inversion tables safe to use? And overall, they are safe, but there are some precautions and people who shouldn't use them. First of all, if you have a cardiac condition, high blood pressure, if you have a history of stroke or glaucoma, anything where you wouldn't want blood rushing to your head, you probably shouldn't do inversion therapy. Additionally, if you have spinal instability, if you had a recent spinal fracture or spinal surgery, or if you have osteoporosis, you probably don't want to do inversion therapy. Likewise, if you're pregnant, then you probably also don't want to do inversion therapy. And if you experience vertigo, particularly if it's positional, you also probably don't want to do inversion therapy. But like I said, for most other people, inverting, at least to some degree, is probably safe to try. If you have questions, talk to your doctor or physical therapist first. Now, one other safety measure that's very important to cover is to make sure that you're locked in very well at your ankles. There are actually case reports of cervical spine injuries or spinal cord injuries that result from falling out of an inversion table. I don't know what type of inversion tables were used in those studies, but just make sure that you're locked in very well at the ankles. This one is one of the most well-known brands of inversion tables, the Teeter inversion table. And to lock it, you bring this up and you can kind of hear it ratchet down, and then it doesn't come out. So you want to make sure you're ratcheted down as much as you can so that your ankles are secure in the device. And then to unlock it, you have to actually press down on this button. It's actually kind of hard to unlock when you're actually trying to do it, which is a good thing because it means it probably won't accidentally come unlocked either. So next, how do you use an inversion table? To use an inversion table, you clamp your ankles in down here, and then the table tips backwards like that to invert you. You'll notice there's a safety strap right here that prevents you from going farther than a 60-degree decline. You can tighten that strap so that you can go less than that, say 30 degrees, or you can actually remove the strap altogether so that you can invert all the way to 90 degrees. But we'll leave that on for right now. Now there's also a foot height adjustment, and it has markers that correspond to your body height, but you may be a few notches above or below depending on how your body mass is distributed. It is important to get that set correctly because that determines where your center of gravity is relative to the table, so you can control how far and how fast you tip back and forth. To get into the device, you'll step on like this, put your feet on the pedals down there, and then again, make sure that this is locked in tightly and that it is secure before you lie back. Now, to go backwards on the table, you start out by raising one arm up. That shifts your body weight more back that way, and you'll notice that the table will start to tip backwards like that. And you can control with your arms how far and how fast you go just by where your weight is distributed. And then you go all the way back there. Now you'll notice that that safety strap catches in, and so I can't go any farther than 60 degrees here. Now you can't really see it well, but there are some acupuncture nodes right here that you can adjust, and that puts pressure on different areas, and that actually feels really good on the upper back around the shoulder blades where you may normally develop some trigger points. And then you can just kind of hang out in this position like this. Again, that one study I looked at said about 3 minutes, and then coming back up and doing that for 3 sets. Now, when you are ready to come back up, you just bring one arm up like that, and then the other arm up, and that helps tip you back up to an upright position. Now, you can go into a fully inverted position like this, but I'd be very careful if you choose to go this far. First of all, make sure there's someone around so you don't get stuck in this position. If you have really good abdominal strength, you can do crunches in this position, but as you'll see, the table stays down, and you definitely don't want to get stuck here. So make sure you practice with the safety tether first, and have someone around if you're going to go all the way upside down like this. To get back up from this position, you grab the back of the seat, you grab the frame, and then pull yourself up to this position. Then you'll bring your arms up this way to pull yourself back up to an upright position. Now, if you think that inversion therapy is something that you'd like to try and you didn't have any of those contraindications that I mentioned before, I'll put a link to this teeter inversion table down in the description below. And if you'd like more videos for back pain and sciatic relief, check out this playlist over here. But before you go, if you found this one helpful, make sure to give it a like, and if you haven't already, subscribe to our channel so you don't miss out on future tips. Thanks for watching, and I'll see you in the next one.